Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update for March 12th, 2021. I believe this is somewhere like our 50th, as we are now in the right at a year since the beginning of it. So as far as email in the health department, it's health@falmouthma.gov. The website that we update frequently, the town updates, there's a COVID link on the falmouthma.gov. You can visit, visit falmouthma.gov. Non-COVID, but, contact tracing, complaints, things of that COVID nature, call the health department 508-495-7485. There's also a COVID hotline for general questions through the county, which is 774-330-3001. These are not for registration of vaccine, registration for an appointment to get a vaccine. So this week, we've been through phase one. So if you're in phase one, first responders look like you're already qualified to get a shot. Individuals over 75 and 65, it's been like that now for several weeks. What's been new this week is K through 12 educators, childcare workers, and school staff were eligible on the 11th. I'll talk about that in a minute. So that's where we're at. So there has been an increase in the eligibility for the K through 12 educators, child workers, and school staff. So there's a little bit of change to the state's website. I'll start off with that. You can now, starting today, only at mass vaccination sites. It hasn't been available to the Barnstable County, our sites, and things of that nature. It's just at mass vaccination sites. There's a new pre-registration sign-up tool. So again, if you're interested in a state vaccination site, this is on what the website looks like when you get to it. You click on registering or pre-registration. A little bit of information. It's supposed to be easy to request and schedule an appointment at one of the 7 sites, mass sites only. Eligible people can pre-register. So once you sign up, you'll receive a weekly status update, and you can opt out anytime if you find an appointment. And it will take, obviously, several weeks probably for you to get an appointment. And you have 24 hours in which to accept the appointment. It could be by phone, by text, and as you fill it out, it'll ask you how you want to be notified. These sites would be Gillette, Fenway, Reggie Lewis, the Danvers, Doubletree, Natick Mall, Eastfield, and the closest one by driving would be the former Circuit City in Dartmouth. A little bit shorter ride than Gillette, but Gillette would be a lot bigger and have a lot more doses available for it. So if you can make it up there, you can do this pre-registration. It would come up similar to this, so I just ran this quickly. You would fill out these forms, check off all the information, keep hitting next, and then you would get weekly email or whatever text updates on how you stand with it. So that's something that's new. Don't be surprised if there's some bugs in it because, as we've known, that the state's site has had some issues since the beginning. So, but there's another opportunity for you. As far as the supply, in terms of the Barnstable County, BCHE is the Barnstable County. That's who the town health agents are working with. We're still sort of in the same 1,170, sometimes a little bit more doses sent to us per week. We're averaging next week we have 2 clinics, which are first dose clinics that go through the prep mod. So again, this isn't a pre-registration. It's not part of that mass vac site. So this would be something you would have to do the old-fashioned way, the way you were doing it up until today, is when it comes up, they go fast, you jump on it. If you get it, great. If you don't, keep trying. We have 2 next week at the 4 Cs for that. And again, as vaccine increases, especially we start getting Johnson & Johnson coming in, you'll start seeing the fairgrounds opening up and Orleans and these other sites that I have listed on the right. The 4 Cs is our main. The fairgrounds, the Orleans DPW, again, as more vaccine, we will open up more clinics. It's just right now there's only a couple of relatively small 500-dose clinics each week based on the volume that Barnstable County is getting, okay? So, that's just what's happening with the county. Now, you still have pharmacies. The pharmacies are really, even though they don't look much different, you go there, you go shop, and they are cranking out quite a bit of vaccine. So you can use that through the CVS website or Walgreens as well. If you're a veteran, you can get it from the VA. The closest one would be in Brockton. So those are the avenues at this point. So you have mass vac sites, pharmacies, the VA if you qualify, and Barnstable County if you get lucky, just because we just don't have enough doses. I wish we were doing at least 1 or 2 a week at the fairgrounds. It's just that there's not enough volume coming our way. This has been huge for us here in Falmouth and other Cape Towns, is that the Cape Cod Regional Vaccine Consortium, I mentioned this last week, that the Cape Cod Healthcare is vaccinating also at the 4Cs, so they're running these clinics in tandem with the county. The county might be running one for J&J vaccine, and Cape Cod Healthcare is running one for Moderna. But so they're running them in tandem because the place is plenty big enough. So they're doing for the region's most vulnerable residents and senior citizens, and it's not an online registration system. Call the senior center to qualify. They'll provide you the information. We generate a list once or twice a week. We send to Cape Cod Healthcare. They will call you directly. We've been very effective with getting people vaccinated through this. If this is the first time you're hearing this and you're over 65 and you can't get yourself registered online and you're having trouble and you're not going to be able to make a mass vax site, you really should have called, or if you haven't, do it now. Call the senior center at 508-540-0196. This has been the most effective way. It kind of cuts through all the online process, which is difficult for somebody who's over 75 who may be new to computers or not on it at all. So call the senior center. If you're truly homebound, and that's those who can't make it to any clinic, are truly homebound, also call the senior center. We are currently vaccinating homebound. We've done some so far. If you're homebound and you cannot, for any reason, make it outside your house, we're using the Community Health Center of Cape Cod and scheduling that. They're scheduling that with you. So they've been great as well. The Community Health Center has been great at reaching out to the homebound based on a list that we provide from the senior center. So the senior center has been the hub at which you as a resident would contact. And this has been huge for us in helping to get people vaccinated that otherwise we're being left out of the golden ticket to the chocolate factory system that's currently there at the state. So again, if you're that age group, please do it. Early education, like I said before, that on 3/11, early education, there's going to be designated, and again, this is subject to change. This is new, so there may be some more information as time progresses, but as of now, any of the 7 mass vaccination sites on the March 27th, April 3rd, April 10th, or April 11th will be solely for early education and K through 12, which are the bullet points I left before: educators, paraprofessionals, child care educators, all the way down, bus and van drivers, safety officers. So the bullet point, you can get this also on mass.gov. If you qualify, you can go to one of those. You have to register, the same sort of system. Pharmacies are also supposedly going to be carving out time for this group as well. The Barnstable County, again, based on our doses, only getting 1,000 or 2,000 doses, may or may not play a role at this point, just because having these vaccines closer for those that are older and less mobile, maybe keeping these vaccines with that group is the best way to go. And that's going to be subject to availability. So if we're still running the 1,100 doses, it's probably still going to be mainly for 65 and older, just because the travel. Somebody who's a teacher might be quite a bit younger, and getting out to the mass vaccination sites would be easier. If more vaccine comes available, then obviously we would love to be able to do more for the educators as well. Maybe at the end, see who hasn't had a chance to be vaccinated and go from there. But so if you can, if you're an educator, you want to get onto these sites and work yourself through it and go from there. In terms of where we are with vaccine, we're up 6.9% from last week of cumulative percentage of individuals with at least one dose administered by a county of residents. So by residents, we have 31% who have received at least one dose. So we've caught up, I think, fairly well to the rest of the state, because we do have more people at the 65 to 75, so our percentages should have been higher as they are. And so that's where we are for this particular week. This is updated every week on the same COVID dashboard that you have gotten the case information from. You just scroll down further and it gives you a daily and weekly vaccination report. In terms of fully vaccinated that have had the 2 doses, or fully vaccinated would also be J&J 1 dose, we're up to 13%, which is an increase of 4.1% from the last time this report came out. It comes out every Thursday. So again, you can get this from the state as well. So 13%. This I thought was interesting. The state just came up with this. This is by town, so it's a little complicated with the numbers, but if you come down third to the last at the bottom, you see Falmouth, age group 65 to 74. which is 18% of our population. We have 3,302 with one dose, which is 59% of our 55 to 74s, and 552 or 10% that are fully vaccinated. Obviously, that's going to lag because it hasn't been that many weeks where it's been opened up for 65s and older. When you go to 75, you see that we've done 3,749. 82% have had one dose, 42% have had two doses. So we are getting there, as much as difficult and as scratching and clawing that we've had to do to get vaccinations, that it has been happening. I think Cape Cod Healthcare has been huge. The pharmacies have been huge. Family members helping out their seniors to get them up to sites, to Gillette and to the mass vax is the way it's gone. And it hasn't been, as easy as just sending it to the local health department and then have us do it. They didn't do it that way. So you've had to scratch and claw. But if you're over 65, you guys have done a great job finding it because we're getting there. And then, so this is going to also be updated weekly at the same place where you got the other slides. There's different charts and graphs for that. So that's where we are with vaccinations. As far as cases, we've been pretty consistent in the last 5 weeks. Our total case count, as of yesterday afternoon, I do that on Thursday afternoons, is 1,226 total cases since March 19th, so we're pushing right around a year from our first case. 8 probable cases since the beginning of this month. 25 confirmed cases over the 7 days. We've been hovering right around that range. About 97+% of all cases are out of isolation. We retain right around 11 to 12% of the total cases with 14% of the county. And of course, contact tracing is nothing we'll stop doing never stop doing until there's no more cases. It's part of the communicable disease tracking that we do. You can see the chart that shows that the last 5 weeks we've had a run of like around 25 to 35 cases. A fair chunk, about a third of these cases or so, cases were from one event, one cluster. So we've actually had maybe even a slightly better week as far as the community is because of those 25 cases. There's been a fair amount of the percentage, like about a third of them, that were associated with one cluster. So factoring that out, you actually have gotten even better. So if that cluster doesn't turn out to be anything more than what it currently is, then, and if we stay on the same trajectory, it would be reasonable to assume we might be in the teens for next week. So let's hope. You never know what's going to happen, but it's actually slightly higher. I guess what I'm trying to say is without that cluster, the cases would have been quite lower. So we've had a fairly good few weeks, and when you start seeing the data from the county and the state, you'll see that it's sort of been flattening out, and this is sort of where we're at for a, late winter case count. You can see we're slowly starting to have that curve flatten. When you can see from December, the steeper this line, the dots, the more cases we're getting. You can see that we sort of start seeing it flattening out and stabilizing around that 25 cases. As far as our color for the week, we remain yellow. We've only had 2 weeks of red the entire pandemic, which is quite good. It tells you the residents are taking it seriously. Our percent positivity was 2.3%, down from 2.47%. We had our case count went up 56 for the 2 weeks, around that 25 or so range, with our positivity of 100,000 of 12.8 incident rate per 100,000. Which is, again, a lot better than it was since about Christmas. We're in that nice pattern here. Not nice, it could be better, but we're in a better pattern than we were previously. Our incident rate is lower than the state. The percent positivity is a bit higher than the state's. Barnstable County, we're doing better than the county for our percent positivity, and also better as our incident rate. And this data is current from 3/9. That's when the state does this chart. You can see this is our incidence rates by town, along the county. You can see that Falmouth is sort of in the middle. We've got towns that have a higher incidence rate. We've had some towns that are lower incidence rate. For our size, I think we're doing fairly good, fairly well. Like we do most weeks, we do slightly better than most of the larger Cape towns, and larger towns that are off Cape, such as the Plymouths and Wareham. So all these towns, Wareham and so forth, we've always fared fairly well. County cases, you can see that sort of same thing that you see with our cases, sort of a flattening over the last 5 weeks and leveling off. And hopefully as we continue to vaccinate and the weather gets better, and if it did what it did last summer with the low counts, plus the vaccinations, I think we'll hopefully be in very, very good shape by then. Hospitalization's been relatively flat, been around 2 or 3 people at Falmouth at any given time, and somewhere in the teens for Cape Cod Hospital. So, the last couple times that this data was given to us, we didn't have any ICU beds occupied over the last 3.3 or 3.10. So that's good and indicative of the case counts that we've had. Statewide, they've been averaging between, right around that 15 plus or minus a couple hundred per day, right around 100,000 tests. Turnaround time's getting better, right around 1.5 days. Positivity's been less than 2%. Hospitalization's been under 1,000 for a couple weeks now. With 122 total patients throughout the state intubated, 176 in the ICU. So, deaths are going to stay higher than what you would probably expect with that, because there's been a delay. So some people that have, when the case counts were higher, got sick, and then it's been a while, and then they end up hospitalized in the ICU for quite some time, and then some unfortunately pass. And so that number's still on the little high side there. You don't want to see any, obviously. So here's our metrics. They're all in a flat to downward trend. That's what we want to see. Hopefully it continues. The vaccine definitely works. COVID testing hasn't changed. You can still go through Falmouth Hospital through your physician, the pharmacy like East Falmouth CVS, you can Community Center of Cape Cod and Mashpee, walk-in clinics like Convenient MD. Fairgrounds does a free test. You call the fairgrounds directly. Wendy over the fairgrounds has been awesome to do that. 508-563-3200, Monday through Friday, 8 to 2. They generally just do testing on Tuesdays. There hasn't been a lot of people that have gone to it. So that has not changed. Capacity limits, I mentioned this last week, that starting March 1st, that there's not a restriction on the percent seating capacity at a restaurant. It's going by social distancing regulations, the 6 feet between tables, which will help some and maybe not help others, depending on how your restaurant's laid out and how your size is and so forth. Musical performances with distancing's allowed. 90 minutes stays in place for a 90-minute time limit, and no more than 6 per table. And then self-serve food courts definitely still will remain closed. A lot of industries increasing to 50% capacity, with employees being exempt. Also, the gatherings limit, this has not been in order yet, because it's going to be dependent upon how the cases look and what the governor does closer to this time frame. But on March 22nd, event venues, 100 indoor, 150 outdoor, private settings 10 and 25. Again, subject to continuing good data from our cases. Going into things, large venues like arenas, ballparks, and stadiums, not counting things like road races and not counting festivals and things of that nature. Just places like Foxborough, Gillette Stadium or Fenway Park will be able to go to a 12% capacity on the 22nd, again, depending on what the data shows. Also, overnight camps, summer camps, things of that. There's also something that we're hoping based on good data. So, things are slowly starting to open up as, people get vaccinated and, of course, as the cases go down. Diligence still needs to happen. Getting tested, staying home when ill, self-isolating, continue the social distance and the face coverings. That's not going to go away right away. Reducing or eliminating travel. You can, if you've been vaccinated, you have new rules about not having to follow that. So if you've been vaccinated, double check with mass.gov, but the most recent data, because there are loosening things up, such as being able to visit family members that have also been vaccinated. So as you get vaccinated, there'll be some of the perks for that. Avoid gatherings and parties indoors without social distancing. If you haven't, that's still always a place. Indoors is the place where it happens. And if you're a business of some and you want to know something, or you've got an event planned or so forth, there's some guidance out there, and I'll follow the guidance, which does change on, especially as cases go down, it will change and loosen up based on, the data. So pay attention to that. Again, recap, state metrics are pretty stable. Falmouth's been stable now for about 5 weeks. Still do get community spread. Cases still do pop in. Regionally, as soon as the vaccine comes in, it'll just keep giving out the vaccine. We are getting there. I mean, by the numbers that the state provided us, it seems like we are getting there with vaccinations. It's been a difficult process and frustrating for a lot, but we are sort of getting there. Again, Cape Cod healthcare has been huge. Barnstable County is doing what they can when they get the vaccines. The community health centers are helping us with our more difficult to get to populations, and pharmacies are just doing theirs directly from the feds, and they're doing it. So that's the places. Keep fighting for it. If you've been left by, don't give up. Again, the big thing out of this, if you qualify, you're over 60, the senior center deals with the residents over 60, over 65, definitely 75. If you're 83 and you're having trouble getting a vaccine, call the senior center, especially if you do not have the ability to register online, okay? I don't want to leave people behind. And the state's loosened up guidance, and so you need to follow that, especially if you're a business. So that's what we have for the week. Things seem to be getting better, and we'll do this again next week, and thank you.